Next, from the Abraham Lincoln Presidential Library in Springfield, Doug Whitley, president of the Illinois Chamber of Commerce, discusses the growing burden healthcare costs are having on Illinois businesses. Mr. Whitley also offers some thoughts on what changes could be made to improve healthcare while controlling costs. This runs about 1 hour. This program is underwritten in part by the Center for State Policy and Leadership at the University of Illinois at Springfield and by the Institute of Government and Public Affairs at the University of Illinois.
My name is Bob Rich. I'm the Director of the Institute of Government and Public Affairs at the University of Illinois. And as you know, we have this policy lunch series that we're very pleased to do in collaboration with the Center for State and Policy Leadership at the University of Illinois at Springfield. And we're particularly pleased today to welcome Doug Whitley to our Policy Lunch series. Doug is a very familiar face here in Springfield, having filled a variety of important roles in and out of state government. Many of you know that Doug is currently president and CEO of the Illinois Chamber of Commerce, which is a position he's held since September of 2001. For the prior 6 years, he was president of Ameritech, Illinois. 2 years, he served as director of the Illinois Department of Revenue in the Edgar administration, where he helped to impose property tax caps. Prior to that, he was president of the Illinois Taxpayers Federation for 14 years. Doesn't have that many gray hairs, it seems, either. He's founded and co-chair of the Transportation for Illinois Coalition, founding member of the Illinois Coalitions for Jobs. Doug is a graduate of SIU, granted an honorary doctorate from Western Illinois University. Doug and I, about a year and a half ago now, got together and we began talking about health reform and healthcare reform and how critical healthcare is. That came at about the same time that our senior senator here from Illinois was mentioning that he gets as many complaints from unions as he does about industry for the lack of healthcare reform as well. And I called Doug earlier this summer and asked him whether he'd be willing to come here today and talk to us on the topic of an employer's perspective on healthcare solutions, and he said he would. And Doug, welcome, and thank you for coming.
Thank you very much, Bob. It's a pleasure to be here this afternoon, and I want to acknowledge so many friends in the room that I've been with over the many years and oftentimes work together on various initiatives. If you have a cell phone on you, I would appreciate it if you'd make sure that it's turned off or placed on mute. I'm going to talk about healthcare. Yesterday I talked about infrastructure, energy, education / workforce development, and intentionally avoided the topic of healthcare because I knew I would have that one to wrestle with today. I'm going to try to cover several aspects of the healthcare agenda. I'm going to leave you with some possible action items, but at the same time I want to make it very clear that the solution is not going to be brought forth today, because I think this is a long, ongoing exercise that both the nation, the government, and each and every one of us as individuals are beginning to have to deal with in a more serious manner than we have historically. I'd like to talk a little bit about recent history and a little bit about the Illinois Chamber and why the Illinois Chamber is engaged in this. I want to talk about the private sector and private sector solutions, touch upon some action steps, and then just close with a conversation about the future of healthcare and some of my observations about that. And then if we have time, we'll do a little bit of Q&A with those of you in the audience who might like to explore any of these thoughts further. Obviously, I stand here making observations about a subject matter which up until a few months ago I really didn't, well, I'll just confess, I wasn't very deep into. But as I've been involved with the Illinois Chamber and these public policy issues that the Illinois Chamber is engaged in bubble up, certainly healthcare has bubbled up faster than any other subject matter that our organization has been engaged in. And I personally have spent more time on healthcare-related conversations, forums, dinners, meetings than any other subject over these last several months, which may be somewhat surprising to folks, but that just gives some indication as to how much attention this subject has been given. Secondly, obviously in Illinois, one of the reasons why this is true is because our governor has made a point to make health care perhaps the cornerstone of his administration and perhaps his vision of a legacy for what he's bringing to our great state. I think that he's probably right to have captured the wave and to ride this wave of health care that is truly taken on the nation. I'm not so sure that he's right about his proposed solutions, and I'm going to go into some of that this afternoon. I would like to observe that the private sector is, I think, more aggressive and was more aggressive and more engaged in healthcare than the public sector has been for many, many years. And I don't think that the private sector has gotten the full credit that it deserves for what it has done over these last many years to wrestle with healthcare, what it means to be an employer and a provider, and come to grips with costs that are related to providing health care. Because one of the points that I want to make to you today is that while health care has become a national debate, in many ways, particularly the focus on the uninsured, I would simply like to observe that the uninsured is a small portion of the total population, and by far the majority of Americans have health care, have improved health care, have increased quality of health care, have become more conscious of health care, and many employers have taken great strides to engage themselves in making sure that their employment base is healthier and wiser about their health care decisions. And I think to a great extent that has been lost. Secondly, I would like to observe that the majority of the people in this nation are provided health care, and we should keep in mind that Medicaid, Medicare, all public employees, all public employee retirees, everybody who's incarcerated, and most of the young are covered by government-funded programs. So it's a significant population that is, in fact, accessing health care. And I would go so far as to say that in our nation, no one is really denied access to health care. The reality is if you show up at a hospital, you're going to get care. Now, you may have to have, in some cases, get moved from one hospital to another, and you may have to go through a lot of paperwork about whether or not you've got any coverage, but the reality is we provide health care. And that coverage, to a great extent, is borne by third-party providers. That is, the employers provide, to a great extent, the cost of health care to the uninsured because that cost is shifted to that third party, that is the private sector. Likewise, the private sector is paying higher cost than they would necessarily have to pay if indeed they weren't covering the uninsured population, and if the state of Illinois, in particular, I can't speak about other states, if the state of Illinois was adequately reimbursing the health care providers for, one, the full cost of providing health care to the uninsured and to the Medicaid covered, and if, two, they were paying it in a timely manner so that the providers didn't have to float interest-free loans to the government covering many, many months.